think in the health sector, we have had a lot of quacks.
Sure.
And it's very hard for one to trust the other one's report. Because of that.
The human resource pillar is not strengthened well.
Yes, and I think that's why standardizing services in healthcare becomes a very critical aspect. Apart from some facilities, maybe like the private facilities, which may not be compliant, some of them comply actually very well.
Do all hospitals have the capabilities like internet? The government provides internet, or the facility will have to sort it themselves?
I think the government has provided a platform of communicating, channeling that information to the ministry. Whether you have internet or not, there are other means of communicating. You can fill the physical forms and they are uploaded at a central station. Like, let's say if you are so much in the interior of the counties, there's a manual form you fill and they are escalated upwards to the county level, and that is important.
Excellent.
And so I don't think so much is me. The government has done so much in that regard, and it's a robust system. It's a good system that helps people to know where we are.
I didn't know that.
It's a resource that so many things that happen in the ministry, I believe, are derived from that, and the planning of resources and human resource for health and all. It gives all those indicators
for planning of all the other pillars.
It also gives the indicators for planning for resources in terms of interventions.
Yes.
And it's a good platform.
Wow. So I always like to know, what are the qualities of a good health information personnel?
From a personal experience and from what should be what I have observed, one should be a good communicator. For you to be a good health information personnel, you have to be a good communicator. Because you are the bearer of information. Unless you communicate, then that information is useless. And remember, this information is used for different purposes.
Yes.
We have education, teaching, that is training. We use the same information for
research. Yeah.
We use the same information for planning, decision making. So if you don't communicate,
yes,
then you have no value.
You break the chain.
And then the other thing is, you must make sure that you manage whatever you are supposed to communicate well, and try to make it in a format that is understood and makes sense.
For somebody who is trying to seek to do health information management as a career, what are the main roles in a day-to-day running in the institution of this person?
Well, before I respond to that,
yes,
one, I said that good qualities, you need to be a good communicator.
Yes.
You need to be one who is very keen to details. You must have analytical skills. Because these figures you get,
you need to analyze them.
You need to put meaning to them.
Okay.
You need to make sense out of them. So you need to have analytical skills. You need to be able to analyze this data and put meaning to it so that you can communicate that information. That is when you make impact. Otherwise, then it becomes just figures. And you see, that is why the ministry is able to make very timely and good decisions, because someone is putting meaning to the data.
Even for management to plan for how many people to employ,
exactly, for budgeting and
for budgeting, for what drugs to stock, what
that's why-
equipment to.
exactly. And that's
So-
why I said it's the bedrock of healthcare.
So before you respond to this thing of roles, sometimes an institution or a government will wake up and say, we want to start psychiatric clinic in this institution. So those decisions are dependent on this data.
Yes, they will assess the need based on the data, because whatever you capture communicates about the need for that service. And it's out of that data that you decide this service needs to be introduced as a new service. And that's how new services come on board, because you look at your data, what does it tell you about what is required? And that informs kind of professions you need on board, the kind of equipments you need. And it actually communicates about all the decision that you have to do to introduce this service.
Not that the governor feels like the mother required dialysis and it was not there, so bring dialysis machines to this county and start dialysis.
I should be quick to say that, healthcare is not like politics, and healthcare should not be politicized. Because when you politicize healthcare, then you may end up, there's politics in everything.
Yes.
But then we need to look at what really is ailing the society and what would benefit the society more. And to me, that will help us to make very informed decisions that will have impact in the society. But when I want to do it because my mother was unwell and didn't get the service, is it what is really needed there?
And you'll know what is needed by looking at the data.
Yes.
Wow. Let's go back to the question we didn't exhaust or respond to. As a health information manager, somebody is trying to get into that career. What are their core business in health space?
Core business of a health information personnel is to, first of all, the process is just you create, store, manage, and ensure availability or access to that information. For the manual system that people are using across, creation of the medical record, you have to make sure that your documentation and capturing of the right information is very key. And that's why you have to have the right requirements for one to capture a patient's details so that there's no issue of mix-up. And then once you have created that record, you need to maintain it. You store it properly. You need to put mechanisms in place to make it accessible. Even if it's electronic, make it in a way that it's accessible. Of course, with controls. Not everybody should access it because of the confidentiality issue. And then make it available at the right point when it's needed. Timeliness becomes a very key thing. So, and being able to manage the data and analyze this data and share the data so that it is used for decision making and improve the quality of care.
So in a daily basis, when we have health information, they're either creating or collecting to archive or store, releasing information. That is their sole. So what about any career? Can anybody open the record?
Well, information cuts across all professions, information management, but healthcare it's a unique field. The way you would manage general records is very different from the way you would manage healthcare records. Because of the sensitivity and the nature of the records, and personal health matters are very sensitive.
Yes.
So it calls for a very high level of confidentiality and And especially with the current Data Protection Act,
Yes.
you have to be very
Keen.
keen
Okay.
who you are sharing the information with, for what purpose. And we are even getting to an era now that with the Data Protection Act, the patient needs to know why you are collecting that information,
Oh, yeah.
for what purpose. Right from the beginning,
You need to give a consent.
they need to give a consent. If you collect that information and you intend it for training, for research, let the patient know.
Okay. Okay.
Others we shall soon we may have a lot of
Litigations.
because of the breach of that act.
So that's one of the quality measure of data collection.
Because as a data processor and as a someone who processes and manages that data, you have a big responsibility under the current act to make sure that confidentiality of personal data
Is maintained. So there's no another person to do it better than a health information manager in a health setup.
He's the key person. He's the key person in ensuring that safety of this patient information is maintained, and he's the professional here. He's the one who knows how confidential this information should be. So they are the people who should advise the rest of the team players in the institutions why it's important for one not even to photocopy or to take pictures of the information just without. So if you are the specialist here, you are the one to advise the rest of the team. The clinician may not really understand the sensitivity of this.
Yes.
For him, he wants the information and
To manage and move on.
move on.
Yeah.
But you are the person responsible.
So let me ask, for the sake of the viewer will wonder, how do you maintain confidentiality? How safe am I that my information in a certain hospital is not going to be leaked out there?
One thing is controlling access. One key thing is controlling access to medical information. Only persons that are authorized to access for specific purposes should be allowed to access that information. And unless otherwise, you as a patient should be informed. Under the current dispensation, you should be informed and you give consent whether your information should be shared or not. But as a custodian of that information, then it's my duty to ensure that your personal information is safeguarded. So I have to have access restriction. And if it is for research, then there has to be proper procedures to be used, approvals to be followed for one to be able to use that information for research.
So can anybody in a hospital who is working in a hospital be able to access a record?
No, you must have a reason why you want to access the record, and it has to be authorized.
Okay.
Because not everybody has any business to do with my personal record.
Yes.
Unless you are my doctor or there's something that you want to do with it that has to do with me, then why should just any other person walk into the health information office and want to access my file?
Okay.
Or my record, or want to access the electronic system and access my record. So you realize that those restrictions are very important. People are malicious.
Yes, they are.
I can look for your file and the next day it is flashing all over.
Yeah.
You know? And yes, because of malice. So as a health information professional, I have to ensure that your information is secure.
Wow. So in a day-to-day basis, what are some of the things that makes you satisfied as a health information record person?
What gives me a lot of contentment and satisfaction is, when you look at a healthcare system, we have very many team players.
Yes.
And working as a team, knowing that I am contributing to the success of that team, to put a smile on that patient, it gives me a lot of satisfaction.
Wow.
Being able to facilitate access to care. Not just care, but quality health care.
Wow.
It makes a lot of difference because I know my role as a health information profession contributes a lot to the quality of service and care that patient is getting.
So what is one of the things that makes you so angry that given a chance you just want to sort it out once and for all?
What makes me angry sometimes is when you want to play your part. It's a system. You would want to play your part, but your role can only be successful if the other person plays their part.
Yes.
It's a process.
Yes.
And unless the other people down the stream, the process line, play their role,
yes,
then you can't. The end result of having that patient receive the right care is not realized.
Wow.
It's frustrating. It doesn't matter how quick and prompt I avail your medical record.
But if another personnel is not...
Precisely.
Wow.
So we have to make sure that it is a flawless system. We have to respect each other as team players. We have to know that each one plays a very crucial role.
And everybody should play their role.
Everybody should play their role they are supposed to be. With respect, mutual respect, and understanding that we are all working towards making sure that Wanjiku or Atieno or that Njoroge is getting
the service
they deserve and the right service, higher level of standard.
So in your career day-to-day learning, who do you look up to? Or what do you look up to?
I think you'd be surprised that one of the guys I really admire, especially when it comes to getting things done, is the late Wishuki.
Wow.
You know, you focus on the goal and do whatever it takes to get the goal realized.
Awesome.
And I think that is what healthcare needs. We need to get the right, problem analysis. So looking at the root cause of issues and getting to know what is the right treatment for our healthcare system. And being able to focus on it and moving towards getting that done. To me, that is what would make me the happiest person. Just having a system that is working, anybody can walk in, it doesn't matter who you are, where you go. I admire the systems that are in place, like in the UK.
Yes.
Where you don't need to go to this private hospital to be
treated.
I'm a public officer and I can walk to any public facilities that access the quality of care that I need.
So now, if today somebody says now IUB is the PS or CS of health in this nation, where will be your focus?
Oh, I believe first of all, having to get things right in terms of what is ailing the healthcare sector.
So you'll go to the root causes.
You have to get to when you treat the symptoms, then the problem remains underlying.
Yes.
So what is ailing the healthcare? And how can you be able to address the issues that ail the healthcare system so that we have everybody towing towards the right direction? And I think most of the public sector, we have a lot of culture change issues. Culture change issues that one needs to try and change.
Yes. Decondition the culture.
Decondition, you reform it.
Yes, for sure.
So that we have people who think quality, who think quality healthcare service, and knowing why they are there. Not because you are brought there by so and so.
For sure.
And I think this culture change, I would really, as you said, as a PS or as a CS, I would really want that culture change to start from the training facilities.
Oh yeah. Oh yeah.
Let us get people out there who have the right culture mindset, the right mindset of why they are going there.
Well,
Because sometimes you look at
the quality of trainees that
quality
we
of
have.
training, even in health information management,
Yes.
we need to have people who understand why they are getting into that profession. What is the right culture and attitude you need to have for you to be able to add value to the profession?
So one of the questions I did ask you is, if today you are not a health information personnel, what will you be? What will you think you will be doing?
I would be that person who, even if you do consultancy or whatever service, just making sure that you're building people to realize their dreams. Someone who is able to build.
It's like a teacher, that's like a mentor, that's
I
like...
love teaching. I don't know
You
why
want
you picked on that.
Oh,
but
okay.
that is one thing I love. Sharing information, empowering people, and just making sure that people have the information they need to do the right thing.
Wow, that's awesome. So what is your parting shot to the nation and to everybody, whoever wants to do health information in this? Your camera is right here.
Health information management is a very good career, and I can encourage many people to take that line. However, they need to have a transformed mindset in terms of things are getting more technological. So we have to try and get skills and knowledge and techniques that are compatible with the changing world. The world is changing very fast, and so let's not be so comfortable. Let's not remain in our comfort zone. Let's be dynamic and let's diversify our perspective, because it is a very wide profession and it can be used by different branches within healthcare, and they are important people.
Wow. Thank you so much. As you've heard, management of information is such a huge pillar. If you're not following me on LinkedIn to learn more about health information management, I think you're missing out. That's all. Let's meet again next time. Enjoy your week.